Drug dependence. Thursday, May 14, 2020. 8:15 p.m. Drug dependence.
Psychoactive drugs. Depressants and opiates. Depressants are drugs that lower your body's basic functions and neural activity, heart rate, reaction time, etc. The most popular depressant is alcohol. Think more slowly, disrupt REM sleep, and form memories, removes your inhibitions. Barbiturates used to induce sleep or reduce anxiety. Depress your CNS. Side effects are reduced memory, judgment and concentration. With alcohol can lead to death. Most drugs with alcohol are bad. Benzodiazepines are the most commonly prescribed suppressant. Sleep aids or anti-anxiety. Enhance your brain's response to GABA. They open up GABA-activated chloride channels in your neurons and make neurons more negatively charged. 3 types: short, intermediate, and long-acting. Short and intermediate are usually for sleep, while long-acting are for anxiety. Opiates are used to treat pain and anxiety. Heroin and morphine. Not a depressant. Used to treat pain because they act at body's receptor sites for endorphins. Different class than depressants, even though overlapping for anxiety. Rest act on GABA receptors while opiates act on endorphin RS. Lead to euphoria, why taken recreationally. Stimulants. Stimulate or intensity neural activity/bodily functions. Range from caffeine to cocaine, amphetamines, methamphetamines, and ecstasy. In between is nicotine. Caffeine inhibits adenosine receptors, can disrupt your sleep. Nicotine also disrupts sleep and can suppress appetite. At high levels, nicotine can cause muscles to relax and release stress-reducing neurotransmitters to counteract hyperalertness. Both physiologically addicting. Withdrawal symptoms from both. Like anxiety, insomnia, irritability. Cocaine is even stronger stimulant, releases so much dopamine, serotonin, and norepinephrine that it depletes your brain's supply. Intense crash and very depressed when it wears off. Regular users can experience suspicion, convulsions, respiratory arrest, and cardiac failure. Amphetamines and methamphetamines also trigger release of dopamine, euphoria for up to 8 hours. Highly addictive. Long-term addicts may lose ability to maintain normal level of dopamine. Hallucinogens. These drugs cause hallucinations, altered perception. Many types of hallucinations. Some even have medical uses. Ecstasy, synthetic drug, both a stimulant and hallucinogen. Increases dopamine and serotonin and euphoria. Also stimulates the body's NS. Can damage neurons that produce serotonin, which has several functions including moderating mood. Causes hallucinations and heightened sensations, artificial feeling of social connectedness. LSD interferes with serotonin, which causes people to experience hallucinations. Hallucinations are visual instead of auditory. Marijuana is also a mild hallucinogen. Main active chemical is THC, which heightens sensitivity to sounds, tastes, smells. Like alcohol, reduces inhibition, impairs motor and coordination skills. Disrupt memory formation and short-term recall. Stays in body up to a week. Used as medicine to relieve pain and nausea. Some hallucinogens are used for PTSD treatment. Allow people to access painful memories from past that's detached from strong emotions, so they can come to terms with it. Drug dependence and homeostasis. Homeostasis is how you maintain temperature, heartbeat, metabolism, etc. If you take amphetamines, body quickly tries to lower HR and get back to normal. Brain is smart about this. If regular drug user, might take it at same time of day. If you're cocaine addict, your brain starts to recognize external cues like room, needles, etc. and knows it's about to get big dose of drug. Brain tells body to get head start, lowers HR before you take drugs. Why you need higher dose over time. What would happen if you get those cues and don't get the drug? You get a crash. If you're in a new location but take same level of drugs, might get overdose. Routes of drug entry. Oral, injection, inhalation. Oral is ingesting something, one of slowest routes because goes through GI tract half hour. Inhalation is breathing or smoking, because once you inhale goes straight to brain 10 seconds. Injection, most direct, intravenous means goes right to vein. Takes effects within seconds. Can be very dangerous. Transdermal drug is absorbed through skin, nicotine patch. Drug in patch has to be pretty potent, released into bloodstream over several hours. Intramuscular stuck into muscle. Can deliver drugs to your system slowly or quickly. Quick for example is EpiPen. Or vaccines, slowly. Faster route of entry equals more addictive potential. Reward pathway in the brain. When you first experience pleasure, brain releases neurotransmitter called dopamine. Produced in the ventral tegmental area, VTA, in the midbrain. VTA sends dopamine to the amygdala. Nucleus accumbens controls motor functions. Prefrontal cortex, focus attention and planning. Hippocampus, memory formation. Nuke. Amygdala and hippocampus are part of the mesolimbic pathway. Different stimuli active circuit to diff degrees. VTA releases dopamine and receptors uptake dopamine. Amygdala says this was enjoyable. Hippocampus remembers and says let's do it again, and nucleus accumbens says let's take another bite. Prefrontal cortex focuses attention to it. At same time dopamine goes up, serotonin goes down, partially responsible for feelings of satiation. Less likely to be satiated or content. Increased genetic risk. Biological basis comes from animal models. Rats and drug experiment, rats keep increasing dosage. Or if sick drug plus favorite food equals avoids it, addictive drug plus fave food equals wants more. Addiction takes over rational mind. Tolerance and withdrawal. Tolerance means you get used to a drug so you need more of it to achieve the same effect. Just took cocaine, lots of dopamine in synapse. Postsynaptic neuron has receptors for dopamine. Long-term stimulation can lead to brain shutting down some receptors. Same amount of drugs won't cause same high. If you go through period of not having the drug, you experience withdrawal symptoms. Things less strong as cocaine won't give you as strong of an effect, so dopamine levels decrease, and you feel depressed, anxious, etc. varies. We'll do whatever it takes to get that high. Once you've built up tolerance, need drug to feel normal again. However, with time and effort brain can reverse back. Substance use disorders. Drugs include alcohol, tobacco, cannabis, opioids, heroin/morphine, stimulants, cocaine, hallucinogens, LSD, inhalants, and caffeine. We have to consider what happens when drugs enter the body and when they exit. Two different processes, intoxication and withdrawal. Intoxication refers to behavioral and psychological effects on the person, drug-specific. Drunk or high. Withdrawal is when you stop after using for prolonged time. Can result in substance-induced disorders. Could be disorders of mood, mania/depression, anxiety, sleep, sexual function, psychosis, loss of contact with reality. Which can lead to substance use disorders. Causing real degree of impairment in life, at work, school, or home. How do you know? By looking at their usage. Are they using increasingly large amounts, stronger cravings, more time recovering from it, failing to cut back, affecting obligations at work/home/school? Second factor is presence of withdrawal. Also tolerance. With caffeine, can't develop substance use disorder. Treatments and triggers for drug dependence. Treatments address physiological plus psychological symptoms. To treat, detox. but sometimes require strong medications to address symptoms. For opiates such as heroin act at neural receptor site for endorphins to reduce pain and give euphoria. Methadone activates opiate receptors but acts more slowly, so it dampens the high. Reduces cravings, eases withdrawal, and can't experience the high because receptors are already filled. For stimulants like tobacco, medications replace nicotine by delivering low levels of nicotine through patch, or deliver chemicals that act on nicotine receptors in brain. In this case prevents release or reuptake of dopamine. Help reduce cravings. For alcoholics, meds block receptors in reward system of alcohol. Also reduce symptoms of withdrawal. Important to prevent relapse during this early stage by minimizing negative symptoms. Inpatient treatments require residence at a hospital or treatment facility. Outpatient means they can live at home and come in for treatment. Cognitive behavioral therapy, CBT, addresses both cognitive and behavioral components of addiction. Recognize problematic situations and develop more positive thought patterns and coping strategies, and monitor cravings. Long-lasting. Motivational interviewing involves working with patient to find intrinsic motivation to change. Very few sessions and can be doorway for patient to engage in another treatment. Group meetings such as AA involve 12-step program acceptance, surrender, and active involvement in meetings. Evidence they're helpful. Relapse is when patient can slip and go back. More addictive substances make relapse more likely. Why it's hard for people to stay clean.